Can we go into high blood pressure a little bit more? There's some
Yeah.
other things you mentioned, hibiscus, that can help with that. Any other products that we can find that might be helpful?
Well, in the range of high blood pressure, there's a definite caution that's probably fairly obvious, that people who have high blood pressure, if it's seriously elevated, need to have professional help. So high blood pressure is not a trivial condition. It can be a serious disease. And it could be life-threatening disease. So people who have more than moderately elevated high blood pressure should get professional counsel and professional treatment. This includes the proper use of diuretics, and that should be monitored by a physician. At the same time, however, and many integrative physicians know that to increase or modify one's lifestyle can actually have beneficial effects on high blood pressure. Moderate exercise can have a blood pressure lowering effect. Reduction of sodium and salt and sodium-containing foods can reduce high blood pressure tendencies. Adding garlic to one's diet or drinking more hibiscus tea can be helpful. Some people recommend using hawthorn. Now, hawthorn is either the berry or the leaf and flower of a particular type of hawthorn plant, usually grown in Europe. Hawthorn berry is a very traditional European jam or jelly or conserve, so it's a food item. But the proanthocyanidins found in hawthorn berry, and also to some extent, a larger extent, in the leaf and flower made into pharmaceutically prepared extracts to make a phytomedicine, hawthorn can have not only a beneficial effect on the activity of the heart muscle, but also has a vasodilating effect and therefore lowers blood pressure. So the good thing about hawthorn is that people who have first or second stage of congestive heart failure can use hawthorn to increase contractility of the heart muscle, at the same time have a mild reduction in blood pressure. So that's a very good combination. Now, at the same time, a caveat. Anybody with heart disease should not be self-medicating. This is not trivial, obviously. I don't need to say that. We don't recommend that people self-medicate for heart conditions, even if it's considered first stage, second stage, according to the 4 stages of the New York Heart Association for determining the functional stages for heart disease or congestive heart failure. However, at the same time, there's a growing body of very strong clinical evidence of using hawthorn berry extracts, or even better, hawthorn leaf with flower extracts during stage 1 and stage 2, either as primary therapies or at the very least adjunct therapies. And there's been a number of systematic reviews in the clinical literature where they take all the research on hawthorn, look at all the data, pool the data together, and show a positive beneficial trend in the contractility, the working of the heart muscle. This is something that every cardiologist should be required to know, because in some cases, using hawthorn either as a primary or at the very least an adjunct therapy along with conventional pharmaceutical medications should at least be considered, especially when you consider the fact that hawthorn has a very high safety profile. There's very little adverse effects associated with hawthorn, or virtually none. There's no herb-drug interactions known with hawthorn, so it has a very high safety profile. Again, one of the reasons is because the hawthorn berry is a fruit. It's not a common food, but it's a fruit that's used as a food, so you have a presumption of safety when you've got documentation of an herb when it has a history of food use.